And I look back at all of the people who were involved in it, and I think of one in particular who wasn't there for the finish. At least he wasn't there in body, but he was there in spirit, and that's Teddy Kennedy. I can recall Teddy Kennedy. I can recall him coming on to the Senate floor when he was battling cancer, when he shouldn't have been there, when his doctor had warned him that if he showed up for a vote, he could expose himself to infection and maybe serious illness and death, but he came anyway, because that's who he is, and that's what he was ready to give his life for, to make sure that the cause of his life would finally end the right way. You remember that cover from Newsweek magazine, which read, "We're almost there," with the big portrait of Teddy Kennedy there. And he talked in there about his early efforts in the 1960s to move the Senate toward this kind of healthcare reform. He wasn't there for the final vote, but what I did was to gather a large color photograph from that Newsweek cover and put it up in the cloakroom of the United States Senate so that every single Democratic senator, as they walked in to vote, had Teddy looking right down at him saying, "We're almost there. We're almost there." And you know, I know there are a lot of us who would have written this bill differently. I favored the public option. There are things I wanted to see in this bill and we couldn't bring them. But remember this, when Social Security was enacted into law 75 years ago, it covered widows and orphans. It has been expanded now, dramatically expanded over the years. Medicare did not cover the disabled when it was enacted into law. We expanded it and changed it and put a cost of living adjustment into Social Security. We made these changes. The only perfect law that I know of that was ever passed and didn't need to be changed was brought down from a mountain by Moses on stone tablets. So don't give up. If there are parts of this bill that you want to see changed, we're going to see those changed.